Have you ever looked in the mirror, tried to smile, and realized one side of your face just won't move? Well, facial weakness can be scary. But here's the truth. It's not always what you think. Sometimes it's Botox. Sometimes it's Bell's palsy. But sometimes it's a stroke. And that's an emergency. So today, I'll be teaching you how to tell the difference and why knowing the signs could save your life or the life of someone you love. I'm Dr. Swathi Laroya-Code. I'm a vascular neurologist and telestroke specialist, and I've treated thousands of patients who've come in with facial weakness, many of whom ended up having a stroke. This is one of the most important symptoms to recognize because getting it wrong could mean the difference between recovery and lifelong disability. So why the face? Well, when a stroke happens in the brain, the nerves that control facial movement to one side of the face can suddenly stop working. That's why facial droop is one of the be fast warning signs of a stroke. Remember, balance, eyes, face, arm, speech, and time for be fast. Now here's the key difference. In a stroke, the weakness usually affects only the lower part of the face. So, if someone smiles, the mouth will droop, but the forehead can still wrinkle and they can still raise their eyebrows up. But in Bell's palsy, which is caused by an inflammation of the facial nerve, usually from a virus, the entire side of the face is weak, and that includes the forehead and the eye. That means the eyebrows won't lift and the eye might not close all the way. Sometimes it's less dramatic, and cosmetic procedures like Botox can give us that aesthetic of having a smooth forehead, which is what we want. But if you haven't been in the injector's chair recently and had sudden onset of this facial weakness and maybe some other signs like numbness or tingling anywhere else in your body, then don't delay. Call 911 right away. I will say that there are a few cases where stroke can occur in the brainstem of the brain and mimic Bell's palsy. That's why in some of my patients, I still get an MRI of their brain because we don't want to miss a stroke. I once had a stroke alert who came in with numbness of her hand and facial weakness and tingling. I had her raise her eyebrows up as part of the neuro exam, and she actually couldn't raise either side. And I turned to my physician assistant and I said, "This is strange, neither side's going up." And my patient, who was in her early 20s, ended up turning to me and saying, "Oh, I get Botox and I just got it done like a week ago." I'm glad she told me. We did end up giving her the clot busting drug, and she did end up having a small stroke in her brain. So when it comes to facial weakness, every minute counts because we can give the clot busting drug to help reduce the disability. So remember, don't delay. Call 911 immediately and let us decide what needs to be done. So save a brain, save a life. If you enjoyed any of this content, please click like, save, and share, and keep watching for more.